Hi, hello, good evening, everyone. This is your Nagraj. As all of you given NORCET mains, I'm here with like all NORCET mains question and like along with the answers keys. If you like want to like in future reference, also you can keep like if those who like if you not get the result also, you can see my video and you can get the analyze of where you done a wrong, where you done a right thing. So where you are lagging, that you can see and you can I can try to like reduce your negatives, reduce your like all your mistakes in NORCET 10. So this video is going to help for your further reference and an analysis of your paper and where you are lagging and assessing your not your mistakes. So don't repeat this one in offset 10. So use opportunity, use your knowledge and sit in exam you analyze the whole concept what you studied in during preparation and all. Then try to put the answer in next upcoming offset 10 exam. So I'm here some question from NORCET main. I'm chosen. So I'm going to discuss all the non-answer main question with the along with the answer keys. So this is like this questions will be like somewhat like appropriate means I cannot say this is a like definite question. This is a like same picture of question has been came in our exam. This all has been like summarized and taken from the all other resources and reference and I'm taken and given you like appropriate answer, appropriate like near appropriate MCQs and answers. Okay. So without delay, we'll start the today's session. This one, like first question of your like NORCET main question. So this one here in front of you. Okay, here we're having a trauma patient and needs to be intubated, and he is being resuscitated in an emergency department. And he had a cardiac emergency response team has arrived, because the patient has gone cardiac arrest, and they are performing. Okay, the code blue team or else emergency response team has been. They are performing the CPR. Okay, they are performing the CPR on the patient, and which of the following is the best method? Okay, which of the following is the best method? Here, how to see focus on best method for confirming the correct placement. Okay, correct placement of the endotracheal tube. Okay, here the keywords patient had cardiac arrest means ongoing cardiac arrest. They are giving the CPR. Okay, the code blue team is giving the CPR. Okay, that time patient has been intubated with the endotracheal tube, and then okay after that placing the tube, how are you going to confirm the placement of the tube? Okay, here the examiner is asking you correct placement of the endotracheal tube during the cardiac arrest. If you see the options, okay, first one option will be first A option will be assessing the lung sound. B option is capnography, or else you can say EtCO2. Okay, end tidal carbon dioxide value, and option C is direct visualization of vocal cord. Option D is none of the above. If you see like look into the all options, we can say like all this. Okay, assessing the lung sound, bilateral lung sound, anterior posterior, and a direct visualization of the vocal cord during after insertion of laryngoscope. You can able to see okay vocal cord is can able to see means you can place the tube into the in between the vocal cord. That's also confirmatory and capnography. Okay, all three are the confirmatory. Okay, correct confirmatory like test done to perform the correct placement of the endotracheal tube. But here they are asking you during the cardiac emergency. If you see monitors, multipara monitors, they will be having the EtCO2 cable will be there. You can attach to that one to the expiratory limb and can able to see the end tidal volume, end tidal carbon dioxide value. Because in stomach, okay, if the tube is placed in stomach, so stomach will not be having a CO2. Okay, CO2. So in lungs only the CO2 will be there. If the CO2 level is 35 mmHg, it confirms the tube is in proper place. Okay. Assessing the lung sound also it's a method to assess the like placement of the tube. But here the option goes okay. Option number B, capnography is the best method. Okay. Here they asked the best method. Best method among the assessing the lung sound, direct visualization of vocal cord. Capnography is the best method for assessing the tube placement. And this one, okay, this one has been discussed in my video lecture. Okay, emergency and critical care topic. That topic I informed you here. If you see the capnography waveform, you can able to confirm. Okay, here 35 to 40 mmHg is the normal EtCO2 level. Okay, EtCO2 is the best method. Okay, escalation also is there, but it's the least method. Okay, when you options are given capnography and escalation, you can able to choose. Okay, you can choose the appropriate best answer, that is capnography. And if you see like second question, patient scheduled for the lumbar puncture. Okay, lumbar puncture LP, lumbar puncture for assessing the okay for spinal fluid analysis. So on duty nursing officer prepares the patient and place him in an appropriate position and maintain the sterility while taking the sample, because if you are not maintaining sterility, what will happen? There is a chance of meningitis. So which of the following additional responsibility of the nursing officer? Okay, here they are asking you what is the additional responsibility of the nursing officer who is working over that area? Okay, here option A is Send the sample to lab. Option B is assess the allergy and reactions. Option C is turn the patient slowly. Option D, take the assistance from the fellow patient and attender to take any help. So if you see all the options, okay, after analyzing all options, option number A is sending the sample to lab, okay, because if you see that all five samples, okay, five unique containers will be taken in a sterile manner. One to be sent for biochemistry, one to be sent for cytology, one will be sent for that cell counts, one will be sent for immunology, one will be sent for your culture. Okay, this all five samples to be sending. Okay, this is the main major like additional responsibility of the nursing officer also working in a that unit. Okay, option number A is a right answer. So if you see like question number three during blood transfusion, okay, patient complains of chills. Okay, here the patient is complaining of chills, lower back pain, fever. Okay, here this is the clearly indicating of febrile. Okay, febrile reaction. Okay, febrile blood transfusion reaction. Okay, in after blood transfusion there are so many reactions. Okay, immunological reaction, non-immunological reaction. So there are so many reactions are there. This one is a here they are having a because chills, fever with chills will only come. Lower back pain and fever is there. So this one is a fever like febrile blood transfusion reaction. You can say febrile blood transfusion reactions. So here because of there may be some WBC, there may be some leukocyte. Okay, there may be some leukocyte that are producing febrile illness in a after transition of blood. So this is the reaction. What will happen if there is any reaction? Okay, there is any reaction. Okay, during blood transfusion, we should not slow down the reaction. We should always stop the transfusion. Okay, we should always stop the transfusion. Keep the IV line open with the normal saline. Okay, what we'll do, like when the blood flow is there, it should stop the blood products, and you should connect the normal saline, and you can keep the flush the line patent because you want to administer if there is a resident present, if there is a physician present, you have to ask for them. Okay, if there is a reaction, I can administer the drugs like antihistamine, steroids, and all. You can transfuse because if you are not flushing the line, not keeping the patent line, mean what will happen if you want to give the administered drug, that time the line will not be patent because it causes the agglutination reaction. So option number B is a right answer. Option number C, if you see administering histamine, antihistamines and all, Avil and all will be later part. First and foremost, like task of nursing officer should be here. They asked you first. Okay, first action should be done. Okay, first action should be done by nursing officer is stop the transfusion and keep the line with the normal saline. And this line, okay, this class I have been like nicely taken in a KNO Academy app, that is your NORCET-9 preparation. So in that video note, I told you here FNSTR. FNSTR means nothing but febrile transfusion hemolytic transfusion reactions. Okay, in that here I clearly written with the bold letter stop the transfusion and flush the line with the NS. Okay, immediately blood transfusion. Okay, what will happen? You should always stop and flush the line with NS. Keep the line patent. Okay, that's what I already told it. I already discussed it clearly. Okay, I took a two class. Okay, or 4 hours video is there. You can watch that one blood transfusion reaction. You can able to like clear all questions which are coming from the blood transfusion. So question number four. Here we are having a patient admitted in the ICU with a type 1 respiratory failure after a drop in SpO2. Okay, after a drop in SpO2, patient is been planned for intubation. Okay, patient is for planned for intubation. So ICU resident or critical care resident or anesthesia resident ask for the boozy. Okay, ask for the boozy. So what is the purpose of the boozy during the intubation? Here the examiner is asking you what is a clear cut indication of boozy using in during intubation. If you see boozy will be like will be rigid or will be rigid blue or white, like flexible tube will be there. It will be having a blunt angle. Okay, curved angle will be there according to our anatomical angle. So option by A, if you see administration drugs. Option B, visualization of vocal cord. Option C, preventing aspiration. Option D, none of both. If you see all options, the right option will be visualization of vocal cord. Okay, visualization of vocal cord. In the exam, that this was the option present. So which one is that? This one is a most appropriate answer. Okay, actually this one used as airway exchange catheter. Okay, airway exchange catheter or difficult intubation or else difficult intubation where vocal cord is very rigid, it's not opening. And that time you can use the flexible. You can able to use the boozy and then you can able to intubate. And then what we'll do, we'll dry load the tube. Then we can confirm the tube placement. It will be helps in it helps in easy intubation. It helps in easy intubation. That is the main purpose. Okay. Here option number B is the right option. Okay, visualization of vocal cords. If you see here, there is a question of Here this is a question of drug calculation. Here very easy answer. This one is I think everybody has answered rightly. Here patient is prescribed with the 6 unit per ml. Okay, 6 units per hour. Insulin has been prescribed with the doctor. The available dose. Okay, the available dose of insulin is 1000 units in 1000 ml NS. So how many ml should be administered by the nursing officer? Okay, here if you see means here the in question only the answer is there. So if you see 100 units, okay, 1000 units, 1000 units of insulin, okay, human insulin, regular insulin in a 1000 ml NS. So what will happen? So 1 ml is equal to 1 unit. So 1 ml is equal to 1 unit. So if you want to, okay, you want to give the 6 units of human atropine or human insulin. So what you have to keep the flow 6 ml per hour. Okay, 6 ml per hour. So option number C is the right option. So here also on so here also one drug related question is there. Here question number 7. Asthma patient. Okay, here we're having the asthma patient prescribed with the 2 puff. Okay, 2 puff inhaler every 6 hours. The inhaler contains 200 puffs. Okay, 200 puffs. The total the inhaler will contain. So based on the prescription of the prescription, how many? Okay, how many days? For how many full days will be inhaler last? So they're asking you like one inhaler. It's containing 200 puffs. So how much long it will be? We can able to use the inhaler they're asking. Here if you see like 2 puff, okay, 2 puff for 6 hourly, okay, for 6 hourly. Then we can see for 1 day, how many hours will be there? 1 day, 24 hours will be there. If you split the 24 hours, 6 hourly means how many times will come? 4 times per day. Okay, 4 times per day. You can do 4 times into. You can multiply the all options. 25. If you multiply means you'll get the 200. You'll get the 200 answer. Okay, so 25 is the right answer. So 25 is the right answer. So here I'm having a patient prescribed with the 100 ml, okay, 500 ml NS, okay, 500 ml, 0.3% is normal saline. So it should be infused for 4 hours. Here the time duration is 4 hours. So using the IV set of, okay, draw factor of 15 ml per hour, okay, 15 ml per minute. So what is the correct drip rate? Okay, the correct drip rate present in per minute. Okay, they're asking you what is the flow rate? Okay, what is the flow rate of the drops per minute? Drops per minute. The examiner is asking you. Here there is a formula is there. Okay, drops per drops per minute is equal to total volume. Okay, total volume to be administered into the drop factor divided by divided by time in minute. That is the answer. Okay, that is your formula for checking the for asking the drop per minute. So here what is the volume given? 500 ml volume is the given. So what is the drop factor? 15. So if you multiply it by 4 into 60 minutes, because we have to convert. Okay, here they're asking you per minute. Per minute means you should always everything should be in a normal unit. So if you do multiplication, 0 0 goes. Okay, here 2 2s are 225s are and 6 3 2s are and 3 3 5s are. So here if you do means what will come? So 25 into 5 divided by 4. So 50. Sorry, 25 into 5. So on 25 divided by 4. So it will come around. If you do multiplication and divide, you will get the value of. So if you multiply means what will get the value of? Will get the value of 31.25. Okay, 31 point. If you multiply this one means you'll get the value of 31.25. Here there is a confusion. Okay, here 31 also is there and 33 also is there. So you can able to answer the 31 draws per minute. That is your right answer. Here like already Dhananjay sir has been taken a class on IFP calculation for NORCET. Okay, long back ago only it's taken. It's freely available in your YouTube. You can go and check can watch the videos and can able to get the answer. Okay, 31 per drops per minute is the right answer. So here like 8 question here having the 45-year-old unconscious patient brought to the emergency department following the RTA. So nurse prepares to assist the ventilation using the bag mask ventilation. BVM nothing but your ambu bag. Okay, ambu bag. So what is the recommended oxygen flow rate to ensure the effective oxygen delivery during the BVM ventilation? So they're asking how much is the flow when you connect the humidifier attached to the auto source. Then how much is the flow you will keep in the humidifier valve to get the adequate filling of your ambu bag. Okay, so that is your maximum you should keep Maximum we should keep the flow of 15 liters per minute. Then only we can able to adequately ventilate the patient. So here, like next question, a 68-year male, okay, old patient came to with a breathing difficulty as increased work of breathing and known case of a COPD. Okay, known case of COPD. Okay, he has nursing officer caring. So what, as nursing officer caring for the patient gives the which position to the patient. So here they're asking you, patient is there with a COPD and breathing difficulty and they're having a increased work of breathing means he's using the accessory muscles for the breathing, having a nasal flaring, difficulty in breathing. So which position you want to give the patient? So of course, whenever the patient is having any respiratory difficulty, you always go for the giving upright position. Okay, high Fowler's or Fowler's position. You can able to give the position for the patient because it increases the lung expansion. Next one, okay, here we're having the 60-year-old patient with undergoing for the central venous catheterization. Means the patient is going undergoing for central venous insertion. Okay, CVC insertion. So we are subclavian route. Okay, we are subclavian route. So immediately after the procedure, the patient develops the sudden tachypnea, absent of a breath sound on right side. So which of the following complications should nurse suspect? So yes, like you were asking for the like resident for putting the central line. So he's chosen a way of subclavian route, okay, subclavian vein. So during what will happen here, if you see means right side, if they're placing a subclavian vein, the lungs are present, okay, the lungs are present, the pleura is present. While inserting your needle, what will happen if you puncture the pleura of the lungs means what will happen? There's a chance of pneumothorax. So option number three, option number B is right answer. Okay, pneumothorax is the most common complication occurred after the central venous insertion. That's why they want to take the X-ray of the central line insertion. So this class, okay, this class I have been taken in a KNO Academy YouTube channel only. If you see the blind trauma chest patient came to you here with a tension pneumothorax, what are the signs and symptoms? So there will be a mediastinal shift will be there and absent lung fields and absent breath sounds will be there. So here, here we're having the 55-year-old patient with a chest tube, okay, ICD, chest tube nothing but intercostal drainage tube. Place it for the pneumothorax means already patient is having pneumothorax, so they place it the chest tube, ICD they place it. So patient, okay, while giving care or while patient become agitated, that time what will happen? The patient will pull out the ICD. So after that, what will happen? After that, what will happen? The drainage while repositioning on the bed. Okay, while repositioning on the bed. So what is the priority of the nursing action? Okay, nursing action. So what you will do? Okay, if you are giving the care for the patient, that time what will happen? The patient will suddenly pull out the ICD, which is placed in intrapleural space. So what will happen if your patient will take out means some atmospheric air may get enter into the pleural cavity and it may cause the sudden tension pneumothorax. So prevent that one. What you have to do? We have to apply occlusive dressing. Okay, occlusive dressing means like occlusive dressing, all three-way dressing we should do. Okay, three-way dressing we should do. We should put the gauze and we should put the elastoplaster on the insertion side. So that's how we can able to prevent the tension pneumothorax complication. So option number C is the right answer. So 12th question. Okay, here a nursing officer, okay, caring for the adult, who is on a HFNC, okay, high flow nasal cannula. So should understand the which statement is correct. Okay, so among the which statement, okay, patient is on HFNC. So among the giving four options, which one is the true regarding the HFNC? So option number A, if you see means HFNC provides the humidification intermittently. Okay, humidification if you see means high flow. Okay, as name itself says, the oxygen is flowing at a high rate, okay, 15 liters per minute, 60 liters per minute, 30 liters per minute. That is a flow rate which you can keep on the HFNC. So if you see, oxygen is a very dry gas, okay, oxygen is a very dry gas, what we're getting in a cylinder. But in atmosphere, if you see means, in atmosphere, we're having the humidified oxygen. But in a auto cylinder, we are having the very dry gas is there. So that one. So what you have to do, our prime responsibility whenever patient is on HFNC, we always ensure the humidification. Okay, we should always ensure the humidification. So option number A is the right answer. So HFNC, okay, already Dhananjay sir has been taken a class, NORCET-9 high yield topics. He has taken a class on YouTube. You can able to watch that one video and I can confirm your answer. So question number 13. Here we are having a 65-year-old patient with a COPD receiving the oxygen via nasal prongs. Okay, here the patient is on nasal prongs at 4 liters per minute flow. So over past hours, the nursing officer observing the increasing wheezing. Okay, increased wheezing and using the accessory muscles and SpO2 dropping up to 86 percentage. Okay, 86 percentage. Here is the case of COPD. Okay, remember the case of COPD. Despite of oxygen therapy, despite of nasal prongs, okay, he's not maintaining the saturation because he's having the wheeze because there is a respiratory exacerbation maybe there, COPD exacerbation maybe there, and like patient is having a exaggerated breathing. Okay, work of breathing is more. He's using the acid so SpO2 also is dropping, but here it's not a concern because like 88 to 92 is the we can able to satisfy the COPD patient saturations. But here 86 is a less only. So what is the next nursing action? So if you see COPD, what will happen? COPD, there will be an obstruction for the CO2 washout. Okay, there will be a CO2 retention will be there. So CO2 retention means we have to ventilate the patient adequately with a higher respiratory rate to wash out the all stored, okay, all retented CO2. So that we can do by the using BiPAP mask. Okay, BiPAP nothing but NIV, non-invasive ventilation. We can able to put the NIV mask on the patient. We can put the patient on BiPAP mode and we can able to wash out the whole redundant CO2. So option B is the right answer. So on BiPAP now, Dhananjay sir has been taken a class on a class on your BiPAP machine. So so if you watch that one, you can able to easily you may have answered in exams. So, next question, 70-year-old patient undergoing for the CPR, okay, undergoing for the cardiopulmonary resuscitation CPR in the ICU. So, patient has advanced airway, okay. Here, the patient is advanced airway means it may be endotracheal tube or tracheostomy tube. Okay, so the advanced, we can say a definitive management of your airway. So, already patient intubated and undergoing for the CPR. They compressing the chest, okay. So, what is the breathing rate? Okay, what is the breathing rate during the CPR? So, means if you see patient is not intubated, we follow 30 raised to 2 ratio. Okay, 30 compression and 2 breathing. Okay, but if the patient is having already intubated means what we can do 5 to okay here we can give 5 to 4 to 5 breaths per minute we can give. Okay, sorry. Uh, uh, fi- uh, If the patient is okay, if the patient is not intubated, okay, we can give 30 compression and two breaths we can give, okay. But here if you see how much minute, okay, 4 to 5 breaths we can give for 5 seconds, okay, for 5 seconds, okay. So sorry, for a one breath, one breath can be given for 5 milliseconds, okay, 5 milliseconds. So for 1 minute we can give 10 minutes, okay, we can give 10 breaths per a minute, okay. 10 breaths is the right answer. So if you see Dhanesh sir already taken a class, okay, already taken a class on a intubated patient. Here intubated patient is there up to okay, up to here you can see means we can give a 10 okay, here we can give a 10, okay, 5 breaths for a second, okay, 5 breaths for a second means you can able to multiply, then we can be able to get the 10, okay, 10 breaths per the 10 breaths per minute we can able to deliver the ventilation for the patient who was on endotracheal tube. So 5 to 6 breath in a second, or else per minute if we say means 10 to 12 breaths per the minute we can able to give the if the patient is having a advanced airway, okay. 5 to 6 for a second, 5 to 6 for a 6 for a second, or else if they're asking you in a minute means 10 to 12 breaths per minute we can able to deliver if the patient is on intubated. So already the answer has been taken. If you see means here 5 breaths per second, 5 breaths per second, or 10 breaths per minute we can able to give on a ventilator patient, okay, sorry, on intubated patient. So next question, while performing CPR, okay, while performing CPR for adult patient, okay, shockable rhythm, what are the shockable rhythm? VT and ventricular fibrillation are the shockable rhythm. Okay, if the shockable rhythm is there, okay, while performing CPR, so shock is delivered. So what is the accurate dose and timing of the adrenaline? Okay, they are asking you when the adrenaline given has been given during the CPR when there is a case of shockable rhythm. So always okay, according to ACLS, okay, 1 mg per adrenaline, okay, 1 mg adrenaline after the third shock we can able to give while performing the CPR. So option of B is the right answer. So next question, here we are having a patient, okay, a patient ICU patient with the acute stroke undergoing for the airway suctioning. Okay, here a patient is already admitted in ICU with a stroke. They are performing the suctioning. Okay, they are performing the suctioning. During the procedure, the patient suddenly develops expiratory wheeze, and increased work of breathing. So which one is the immediate complication mostly suggesting? So here the examiner is asking you what is the complication after doing the suctioning for the patient of stroke. So what is the complication or develop of the suctioning? So if you see like our airway is very sensitive. If you try to put some foreign object, what will happen? There will be a chance of spasm. Okay, there the body try to react for the foreign particles. Okay, if there is a suction catheter going inside your bronchus and larynx, what will happen? There is a chance of bronchospasm. There is a chance of reaction. So option number A is the right answer. Here they are clearly given you the symptoms. Okay, expiratory wheeze. Wheeze means nothing but your bronchi is constricting. That's why patient is having expiratory wheeze sound and increased work of breathing dyspnea due to the bronchospasm and laryngospasm. So that are the most common complication can be seen in case of suctioning. So next question, here we are having the image based question was there. Here if you see this one is a jugular vein. Okay, jugular vein is here. Now if you see means normally this will not be that much distended. If it is that distended means we call that one as jugular venous JVP distension. So when so they asked you identify image and what is the cause. We see two terms are there. Okay, always there's a two terms are there. The confusion between the two terms, fluid overload and hyperolemia. So if you see fluid overload is a it's an collection of fluid in third space. Okay, third space we call as fluid overload. If you see volemia means amia means always blood. Okay, always in a blood. So blood is more. Okay, blood volume is more means we call as hypervolemia. This one you can say. Okay, option number A is the right answer. Okay, fluid overload is a sign of seen in case of congestive heart failure and your chronic kidney disease. You can able to see fluid overload. So option number A is the right answer. So this one I'm taking a class, okay, class on fluids, okay, on an app, on a KNO app, you can take a class on fluids and electrolytes. If you see, okay, extracellular fluid, interstitial fluid, and intravascular fluid. Okay, interstitial fluid collection we call as that one we call as fluid overload. And intravascular, okay, if there is increased amount of intravascular fluid we call as hypervolemia. So question number 18th. Okay, here what is the main purpose of LMA? Here they asked you what is the main purpose of using the LMA. Option number A to provide the definitive airway for long-term ventilation. No, this is not the right option. So to serve the alternative for endotracheal tube intubation. No. To replace the tracheostomy in emergency condition. No. To deliver the drug. Okay, this one is not option. Okay, so option number B is the right option. If you see, like when there is a difficult intubation. Okay, when there is a difficult intubation means when the resident cannot able to pass the endotracheal tube into the vocal cords. That case, what we can do if there is a failed airway. Okay, if there is a term called as failed airway. Failed error means after two attempt. Okay, after two attempt also they cannot able to place the endotracheal tube in that what we call as failed airway. That time what will happen? We cannot able to attend one more time because it increases the apnea period. It can cause the hypoxic ischemic encephalopathy. So to prevent that apnea time, what we'll do? We'll insert the blind insertion device like LMA. So it will act as alternative. Okay, to act as alternative airway during intubation. Okay, until the definitive airway, until the tracheostomy or until the needle cricotomy will done. That time what we'll do, we'll put the endotracheal tube until to maintain the patent airway. So it acts as alternative to the endotracheal intubation. So until the definitive management will arrive, we will place the patient on LMA, then we can able to intubate the patient or able to tracheostomize the patient. So option B is the right answer. So here Dhananjay sir already taken a class on LMAs, Supreme LMA, Progil LMA, your Advanced LMA and IGL LMAs. Here they asked you, okay, image based like image based question. This one is a identify the given image. Okay, this one is everyone's answered. What diverse retractor? So options are like the options are like diverse retractor is not there. So this one is like we can take this one is a devious retractor. Okay, this one is diverse retractor. Okay, diverse retractor. I think everybody has answered this one rightly. You see this one, okay, this image based education has been like we have been uploaded in our KNO test series app. Okay, KNO free test series. Okay, KNO free test series we given the image this image. And now one more is there. Okay, and this one is also image based question. Here this right option is green Armitage force. This one is here we are having the pediatric. Okay, pediatrician is there. Okay, pediatrician orders the intravenous calcium. Okay, intravenous calcium for the 1 year. Okay, IV intravenous calcium for 1 year old with the symptomatic. Okay, with the symptomatic hypocalcemia patient. So what is the method? Okay, method of administration should not be performed during the calcium gluconate injection. Okay, injection calcium gluconate has been administered by, advised by the doctor. So what should not be? Okay, what should not be done during the IV insertion of calcium gluconate. So if we see fast IV, okay, fast IV, rapid push, which we should not do. Okay, we should never give a calcium gluconate IV fastly because it will cause flushing. It cause the flushing or heat reaction. So never push the IV calcium fastly. So IV push is right. Like option number A is right. So we always prefer to give the calcium very slowly over 10 minutes. So option number A is the right answer. So if we see here, I'm taking the calcium gluconate. Okay, here because this one is a vesicant fluid. So always give slow IV push. Okay, never give IV rapid push. Okay, rapid flush or flush you can not give. So here we are having a ECMO, okay. Patient receiving the ECMO. ECMO nothing but extracorporeal membrane oxygenation with a stable machine setting. And suddenly patient oxygen saturation will come down, okay, will falls to 85%. So what is the best nursing? Okay, best is the best nursing priority action to be done in done in case. So what we'll do? Like first, when there is drop in SpO2, you should always go and inspect the machine. There is any like oxygen concentrator failure or a pump failure or there is any leak in the circuit or any kink in the circuit. So there is no oxygenation happening. So first, what you will do first and foremost things should always assess the ECMO circuit. There is a possible clot formation or anything you can been able to see that one. So option number B is the right answer. So always go and assist the and see the inspect nicely for ECMO machine. So any clots, any oxygen membrane concentrated pump failure. This all I can able to see after the only able to do like a discontinue of ECMO or the rest all options you can able to see further on. So here, okay, ECLS, okay, extracorporeal life support. I'm taking the class on the like ECLS, extracorporeal life support. Here we're having the patient diagnosed with the DVT. Okay, here we are having the case of DVT. Already patient has been diagnosed with the deep vein thrombosis and receiving the unfractionated heparin infusion. Okay, heparin infusion is going on. So latest activated. Okay, APTT levels are 85 seconds. Okay, 85 seconds. So what is the most appropriate nursing action? So patient is already diagnosed with the DVT. So therapeutically, the patient is getting the heparin infusion. So okay, while doing heparin infusion, so always you should check the APTT levels frequently. So APTT levels are 85. So what is normal APTT levels? 35 to 45 seconds. This is your normal APTT values. So here what it's happened? So 85 seconds it's increased. Okay, it is increased. But if you see, okay, to maintain therapeutic level of heparin, should always multiply normal value with the 3. So if you multiply with the normal value with the 3, you will get the 3 5 the 15, 3 4 the 15. Sorry, 3 5 the 15, 1, 3 9 the okay. It will become it will be sorry. It should always multiply with not 3. It should multiply with the 2. 2 or 2.5 can multiply means we'll get the value of 85 82 we'll get the value of 85 only. So this one is a 85 is a normal therapeutic level. Okay, 85 is a normal therapeutic level. So what we will do, normal therapeutic level, it will not do anything, so we'll continue the same treatment without any changes. So because we're achieving normal therapeutic level of APTT by the giving IV infusion of unfractionated heparin, so we'll not change anything, so we'll continue the same flow of heparin infusion. So option number D is the right answer. So here, 25th question. Here we are having the burn patient. Okay, burn patient is there. So admitted in a admitted with a sudden TBSA. Okay, total body surface area of burn. Okay, using a Parkland formula. Total calculated fluid requirement. Okay, requirement for 28 hours is 4,000. So they already given. Okay, they already calculated the Parkland formula and they given. Okay, for 24 hours they given volume of 4.8 liters. Okay, 4,800 ml. So how much should be given for 8 hours? Okay, for if you see initial 8 hours, we always give the half amount of total fluid. Okay, after remaining 18 hours, we'll give the remaining fluid. Okay, remaining fluid. So 8 hours, like okay, if you dividing 4,800 divided by 2, you get the 1,400. Okay, sorry. Okay, 1,400 will get. Okay, 1,400 around 1,400 will get. So 1,400 is not an option. Okay, here appropriate 1,200 is a right answer. Okay, 1,200 we can able to give in a first. Okay, sorry. 2000. Okay, it's two twos are two fours. Okay, 2400. Okay, 2400 is the right answer. Okay, 2004 is the right answer. Means first half. Okay, first half we should always give within 8 hours. So option B is the right answer. Okay, 2400 ml we can able to give in first 8 hours. Okay, remaining 2400 could be given in a remaining 16 hours. So this one is an image-based question. So image shows specialized infant feeding bottle. Okay, this bottle commonly used for like infants feeding with the cleft lip and cleft palate. So identify the feeding device. Here, this one is a Haberman feeder. Okay, here this is a Haberman feeder. I know like so many people are like answered in mains like mains as pigeon feeding bottle. So that is not the right option. This one is a Habernet feeder. So this class has been okay. This image okay clear. The same image has been taken by the necessary NORCET-8 mains paper solution. So here they asked okay identify the following image. Okay, here if you see this one is a spinal procedure. Okay, spinal needle has been placed in a in your spinal space. Okay, here this one is clearly indicating of epidural anesthesia. Okay, this one is a epidural anesthesia. Here, okay, next question. A nurse is hear the alarm. Okay, nurse hear the alarm of an infusion pump attached to the patient. So, after giving alarm, okay, after hearing alarm, so what the nurse will do? So, if you say turn off the alarm, okay, we never do turn off the alarm. So, option B, changing the infusion pump immediately. No, will not immediately change. So, next option number C is check for occlusion. Okay, if there is any alarm, occlusion alarm, syringe goes alarm, so okay, any alarm will come means you will check for the occlusion, whether line is patent, whether kink is there, that and all will rule out first. Okay, option number C is the right answer. So next one, 29 ninth question, very easy one. Okay, Kawasaki disease primarily affect which type of blood vessels? Okay, it affects mainly medium blood vessels. Okay, medium blood vessels are affected in Kawasaki disease. So next question, which one is the following clinical manifestation seen in heat stroke? Okay, seen in heat stroke, except. So they're asking you, okay, which is a symptom which is not seen in heat stroke. If you see heat stroke, before the heat stroke only, the sweating phase will finish. Okay, the sweating phase will finish. So sweating is the not right option. Okay, sweating is not seen in case of heat stroke. So before the heat stroke only, the sweating, profuse sweating will be there. So excessive sweating is the right answer. Right answer. Okay, this cannot be seen in case of heat stroke. I think many of the people has been like answered not or this one excessive sweating is a not answer because like they think like heat stroke means the sweating will be there, but it's not the right option because in first phase of the heat stroke only there is a loss of excessive sweating will be there. So in later case of heat stroke there will be a dry patient will be very dry. Here, like next question, here patient undergoing for the operation theater for abdominal surgery, and the nurse administer the injection atropine. Okay, injection atropine IM. Okay, in exam they given IM. Okay, priorly half an hour before the surgery. So patient attender asks why the injection has been given for the procedure. Okay, the nurse explains that okay, it enhances the effect of anesthetic medicine. No, option number B, it reduces the secretion of GIT. Okay, of course, it reduces the GIT secretion and bronchial secretion because atropine is an anticholinergic. Okay, it's an anticholinergic, so it will prevent the all GIT secretion to prevent the aspiration and it will prevent the bronchial secretion. So there will not be any atelectasis or any lung infection after the long surgeries. So option number B is the right answer. So if you see about atropine, okay, in pharmacology during like before mains, okay, prelims before I taken a class pharmacology rapid revision. On rapid revision class, I told you clearly about the atropine. Next question, okay, here the patient with the like following enzymes disturbance, okay, disturbance are seen in case of pancreatic disorder. Here there is a SATA question, select that all apply. Here if you see, okay, all pancreatic case because like pancreas will produce the pancreatic juice. Okay, in pancreatic juice if you see means amylase will be there, lipase will be there, and your trypsin will be there. Okay, and your trypsin and chymotrypsin will be there. So these are the major enzymes released by your pancreatic juice. In case of pancreatic what will happen? This all secretion will be increased. So you can see the option which are having all three option. Okay, like 1, 2, and 3. Okay, 1, 2, 3 as there means that is the right option. Option number A is the right answer. So here, like very like a single liner knowledge this question is there. Major contributor for chronic hepatitis in a leading chronic liver disease case. Okay, CLD case. So who is going to contribute more? Okay, more for chronic hepatitis case. So hepatitis B and C are the major. Okay, major contributor for causing chronic hepatitis. So next question, patient suddenly develops severe pain. Okay, here the patient suddenly develops the severe pain, sympathetic signs. Okay, so all sympathetic triggers are there. So patient heart rate is increased because of pain. Heart rate is increased and elevated BP, blood pressure is elevated, and respiratory rate are high, and dilated pupils. Okay, these all are the signs of sympathetic drive. Okay, this all are all the symptoms of fight and flight. Okay, fight and flight response. Okay, sympathetic drive symptoms are there. So this all are seen in case of acute pain. When the patient is having acute pain, there is a drive. Okay, there is a increase. Okay, pain threshold will be there. So what will happen that time? Your sympathetic nervous system will activate. So all your okay, so all are the symptoms of sympathetic drive. So option number B is the right answer. Acute pain only we can able to see the all is case of sympathetic drive symptoms. So next question here the patient with the diabetic insipidus receiving the vasopressin. Vasopressin nothing but it is an ADH, okay, antidiuretic hormone. So it what will cause it will prevent the urine loss and it will press the vessels. Okay, it will constrict the vessels. It's also called as vasopressor or vasoconstrictor. So follow finding the treatment shows whether treatment is working or not. Okay, patient is diagnosed with the diabetes insipidus. What will happen in diabetes insipidus? There is a loss of there is a less release of ADH. Okay, the deficiency will be there. So after receiving the proper therapy, okay, with the vasopressin, so which findings will show the treatment is working or not? If you see like what our dash name is also says anti anti-diuretic hormone. Okay, it is an anti-diuretic hormone means it prevent the urine output. Okay, it prevent urine output will not be there if you give the vasopressin. So what will happen? The if whatever amount of urine will go, that is there will be a increased urine specific gravity. Okay, there will be increased urine specific gravity will be there. Okay, normal urine specific gravity will be at 1.010. If here it is increased, so option number A is a right answer. Okay, if there is increase in urine specific gravity means we can say the treatment is working. The vasopressin is working. So about like diabetes insipidus here, if you see means diabetes insipidus, ADH, okay, vasopressin, everything I dealt in a MSN integrated MCQ on KNO Academy app. Next question related to the ABG. Here we are having the 24-year-old, okay, admitted in ICU on ventilator intubated. Okay, ABG has been performed. Okay, following ABGs are so blood pH is 7.52 means what is normal value? 7.34 to 7.43 is a normal value. Here increased pH. Okay, increased pH means reduced room, respiratory people and metabolic opposite. So here there is a chance of respiratory problem. Okay, respiratory problem is there. So PCO2, PO2 is 50 ml. Okay, PCO2 is 28. Means PO2 is washed out. Okay, there is a loss of PaCO2. Carbon dioxide washout is there. So bicarbonate is normal and respiratory rate is 32. Okay, normal respiratory rate will be 1620. So increased respiratory rate. So that's why there is a loss. Okay, there is a washout of PCO2 is there. So what is the probable cause of this finding? So the examiner is asking you what is the probable cause of respiratory alkalosis. So here if we see pulmonary embolism. Okay, in case of pulmonary embolism, what will happen? The patient will be having blocked. The clot sitting in a pulmonary artery. It is blocking the way. So that's what will happen. This all symptoms are seen in case of pulmonary embolism. So here if you see means about respiratory alkalosis, alwards I dealt in a like a KNO app or ABG interpretation. PCO2 washout, respiratory rate is increased, and your like depth of respiration is increased. Okay, that is that case we can able to see respiratory alkalosis. Next question. Here we are having the patient urine output less than 100 ml. Very easy question. Less than 100 ml per day. Like we call that one as anuria. Okay. When we call oliguria, when the urine output is less than 250 ml per day, we call as oliguria. And polyuria, when the urine output is more than 2.5 liter, we call that one as polyuria. Nocturia means when the like when in night, okay, during night, if the urine is passing, okay, without control, urine is passing means we call that as nocturia. Next question. Here we are having the patient. Okay, patient with the OP poisoning. Okay, organophosphate poisoning is there. Brought to the emergency department. Which are the following? Okay, which are the following actions should not be appropriate for initial management? If we see OP poisoning, what will do? OP poisoning case, what will do? First, will do stomach wash. Okay, first will do stomach wash. After that, we'll start the atropine infusion. After that, we'll give the PAM injection. So after that, we'll stabilize the patient with the glycopyrrolate also. So these are the management done in case of OP poisoning. So adrenaline, starting adrenaline is never okay. We never start the adrenaline infusion until the patient will go for arrest. So this one is a which will not do. Okay, here they're asking you, okay, which of the following is not appropriate management of OP poisoning. So starting adrenaline infusion is a not the appropriate management in case of OP poisoning. Okay, in case of in this okay, if there is a atropine is there, we can able to choose the atropine as an answer. Okay, but here we are not starting the adrenaline infusion in case of OP poisoning. And next question. Here we are having the okay stenosis or atresia. Okay, there is a stenosis and atresia of the foramina luschka and foramina magendi. Okay, these two two CSF tracts are like a stenosis means there is a block, there is an obstruction is there. So is condition seen in case of what? Option number A, Dandy-Walker syndrome. Okay, and Dandy-Walker syndrome is a right option. Okay, here what will happen? The both okay because of congenital disorder. Because of congenital disorder, there will be a brain herniation. Okay, brain will herniate. So there will be a foramina Lischka and foramina Magendie. Both will be blocked in case of Dandy-Walker syndrome. Next case, okay, next question. Which of the following cause of hyperphosphatemia? Okay, increased phosphate level. I told you in a electrolyte class, there is an inversal relation of phosphate and the calcium. Okay, if the phosphate is rising means there is chance of hypocalcemia. Okay, hypocalcemia is a right option. Okay, these are vice versa. But phosphate and calcium are inversely related. I'm not going to like explain in detail because I'm already taking a class on fluid and electrolytes. Very important. Watch it. Okay, watch it in a app. So here, if you see means okay, I am clearly written phosphate and calcium are inversely related. And next question. Here we are having the patient with the osteoarthritis and gastric ulcers. Okay, present with the joint pains. Because the following analysis are most appropriate for the pain relief. Means here patient is complaining of pain because osteoarthritis and means patient will be having severe pain. Okay, severe pain will be there. In severe pain, okay, which are the drugs? Okay, already having a like gastric protective. Patient is having the gastric ulcer also is there. So which analysis you will prefer? Okay, if you see means all your drugs are what they will do, they will block the COX. Okay, COX pathway they will block means cyclooxygenase. They'll be having okay prostaglandin synthesis and your inflammatory mediators are released by the pain mediators. Inflammatory mediators are released by COX pathway only. So all our analysis what will happen, they will block the COX. The blocking COX means both will happen. Your prostaglandin synthesis will stop. So what will cause if stop means there is a our prostaglandin will be covering your GI mucosa. If it is not covering means what will happen? There is a chance of HCl erosion. There is a chance of gastric ulcer. So what will happen? We'll give the selective. Okay, we'll give the COX-2 inhibitor. Okay, selective COX-2 inhibitor in case of gastric ulcer patient. So that is your COX-2 inhibitor is your etoxirib. Okay, etoxirib is a COX-2 inhibitor. So option number D is the right answer. Okay, right answer. So next question will be next question will be your here there is a like patient present with a burning and like shooting neurogenic pain with a right leg a sign of acute inflammation. Which of the following medications are most appropriate for first line therapy? Okay, first line therapy for neurogenic pain. Okay, here the examiner is asking you what drug. Okay, what is the first line of drug given in case of neuropathic or neurogenic pain? Here like gabapentin, if you see gabapentin or pregabalin. Gabapentin or pregabalin is a drug of choice. Okay, they are the drug of choice in neuropathic pain. Okay, neuropathic pain. These are the drug of choice. So option number A is the right answer. Here psychiatric question is there in front of you. Psychiatric question. Here the patient prescribed with the nicotine gum as a part of smoking cessation therapy. So which of the following is correct? Okay, correct instruction regarding the chewing of nicotine gum. Here if you see, like option number A is the right option. Slowly chew the gum. Okay, slowly chew the gum and nicotine gum until tingling sensation will felt. Okay, means the patient is having, okay, basically addicted. Okay, smoking, what will release, it will release the nicotine. So what will happen, there will be a tingling sensation. So until you chew the like slowly you have to chew the chewing gum. So until that sensation will feel down, means until you feel the satisfy of nicotine release. So that is the right option. Next question. Here, like the statement true regarding the hypoxia. Option number A, hypoxia and hypercapnia cannot occur together. Option number B, drowsiness is a early sign of hypoxia. No, never. If you see hypoxic patient, early they will be very restless, very agitated. That is the first sign of oxygen requirement. Okay, first sign of hypoxia. So drowsiness is the first sign of hypercapnia. If there is increased CO2, okay, increased CO2, CO2 narcosis will be there. But if there is O2 hungerness, means that time patient will struggle. Okay, patient will be restless, agitated. That is a first sign of hypoxia, not a late sign. Okay. So here, like late sign will be a cyanosis. Okay, cyanosis. Okay, your central or peripheral cyanosis will be seen in case of, okay, late sign of hypoxia. So option number C is the right answer. Okay, option number C is the right answer. So cyanosis is the late sign. Okay, restlessness and agitation is the first sign of hypoxia. Next question. Here the patient with a mechanical ventilation, suddenly there is a trigger of high peak inspiratory. Okay, high peak inspiratory pressure. Okay, peak inspiratory pressure alarm. So what is a nurse immediate action? Okay, if there is a ventilator alarm is there, okay, high ventilatory alarm is there, then what we will do, we will go attend the alarm. Then if indicator, okay, if there is inspiratory, okay, high inspiratory pressure means the ventilator is pushing the air into the patient, okay, into the patient, but there is a resistance over the inspiration part. So what will be a chance? There will be chinking, there will be a like obstruction, or there will be a secretion. Okay, there will be mucus secretion that is blocking the airway. So what will happen, that time there will be increased inspiratory pressure will be there. So that time what we will do, we want to perform the suctioning and clear the airway secretion, then the airway pressure will come down. Okay, always perform the suction when there is a increased airway pressure is there. So the option number A is the right answer. So this one, okay, directly, okay, this question I have been like taken from the like MSN rapid revision class before prelims. If you watch the session, it will be very useful for solving the ventilator or ICU questions. Okay, here I am taking the class. Okay, suddenly start between the high peak pressure. Okay, high peak pressure. That time what will do? Immediately endotracheal suctioning is the right answer. Okay, I already discussed it in the like mains question prelims before. Next question. Here we are having the case with the case of CKD on regular dialysis, and after dialysis also patient serum potassium levels are increased. There is a hyper hyperkalemia present. Okay, there is a hyperkalemia present, and ECG tracing tall tented P wave means already, okay, not only like serum values, we are having ECG changes also there. So what is the best method? Okay, best immediate method to prevent the cardiac membrane instability. Okay, if we see like there is a potassium overload, means what will happen, there is a the potassium will maintain the negative action potential among the heart cell, okay, heart smooth muscles, cardiac smooth muscles. So if your like potassium is more, there is a chance of, okay, there is a chance of unstable cardiac myocardium. So to stabilize the cardiac membrane, okay, to stabilize the cardiac membrane, what we have to give? We have to give the calcium gluconate injection. Okay, this calcium gluconate membrane, okay, gluconate is considered as cell membrane, cardiac cell membrane stabilizer. Okay, cardiac cell membrane stabilizer. So it can act as life saving. Okay, it can act as life saving for the lethal arrhythmias. Okay, for the lethal arrhythmias from the hyperkalemia. So always prefer the calcium gluconate over the or dialysis. Next, okay, this one calcium gluconate I already told in a class. Okay, management of this one is a management of hyperkalemia. Okay, fluid and electrolyte class. I taken a class on. Okay, I taken a management how we will manage the hyperkalemias. So calcium gluconate 10 components, 10% is weight by volume. IV slowly we can give the calcium gluconate in case of lethal arrhythmias produced by the hyperkalemia electrolyte imbalance. Next one, here we are having the patient prescribed with the piperacillin tazobactam IV gentamicin. Okay, piperacillin tazobactam along with the IV gentamicin. So administration, okay, which administration treatment is the most correct? If you see gentamicin and the piperacillin tazobactam are the drugs given, okay, given together means they will produce the synergistic effect. If you see piperacillin tazobactam are the beta-lactam inhibitors, and gentamicin is the aminoglycoside. So what is there? Like first you transfuse the piperacillin tazobactam. After that, like 10-minute gap, after the half an hour gap, you can able to give the gentamicin. Then the synergistic effect will be like increased. So administer here, like give the okay, option number A is give the both drugs simultaneously through same line. No, if you're giving the both drugs simultaneously through same line means there is a chance of precipitation. Okay, there is a chance of precipitation. If you see piperacillin tazobactam, it will be very oily. Okay, very vesicant fluid will be there. Very vesicant drug will be there. So if you're giving gentamicin and piperacillin, what will happen? There is a chance of precipitation if you're giving the same line. So option number A is not right. Option B is give gentamicin, like then start the tazobactam, piperacillin tazobactam after 15 minutes. Later on, flush with the without flushing. So without flushing, okay, never we should not flush. Okay, if after giving gentamicin, you always flush with NS, then you can able to start the piperacillin. So this one is the right or not right option. First one, okay, so option was C, administer separate IV lines. Okay, if the same line flush well, then separate dose will be at least 1 hour gap. Okay, option number C is the right option. Means what is this option? Option is saying means first, okay, first give the peptaz. Okay, give the piperacillin tazobactam. After that, okay, wait for the 1 hour or half an hour. Then you can able to give the gentamicin. So there will not be any precipitation reaction. So option number C is the right answer. Next question. Okay, here the patient is okay. Like pharmacology question. Patient has been administered with the sublingual NTG. So, which of the following adverse reactions should nurse expect? Okay, means what is the side effect? Okay, what is side effect of giving the NTG through sublingual rate? Okay, what does NTG will do to body? It is an inodilator. Okay, it's an inodilator. Means it dilate the all vessels. It's an inodilator. So inodilator means what will happen? There will be a vasodilation. Okay, there will be a vasodilation. So if there is a vasodilation, if the brain vessels are dilating, means what will happen? There will be a dizziness and headache. Okay, this one is a right option. Okay, this one is a ADR. Okay, adverse drug reaction produced by a sublingual NTG. And next one here you have the according to standard protocol. Okay, according to standard protocol of ATCL. Okay, ATCL advanced trauma life support. Patient present with the scrotal ecchymosis. Okay, scrotal ecchymosis is there and prostaglandin swelling is there after the trauma. Okay, after the pelvic trauma. So which of the following should be avoided? Okay, here the examiner is asking you what should not be done in case of scrotal ecchymosis and prostaglandin swelling in case of trauma case or pelvic trauma case. So always, okay, here they already given scrotal ecchymosis and prostaglandin swelling is there means it indicative of urethral injury. Okay, this both factor indicating the urethral urethral injury. Okay, both factor indicating urethral injury. So always, okay, urethral injury is there means you should always avoid the urinary catheterization. Okay, if you are doing again catheterization, what will happen? Again, it's going to cause a trauma and again it's going to cause harm the patient. Next one, here we have the patient with the bladder cancer receiving the intravascular nothing but bladder intravascular therapy of mitomycin. Okay, mitomycin they are planning to give the patient. So what should the nursing intervention? Okay, what should the nurse instruct to the patient? Okay, educate the patient regarding the bladder management. Okay, if you see the drug, okay, mitomycin is the chemotherapy drug. Okay, it's an chemotherapy drug. Okay, to prevent systematic effect of chemotherapy drug, they are directly locally injecting the drug into the bladder. Usually, what will happen? The mitomycin they will dilute the drug. After that, they will put the Foley's catheter for the patient through urethra. After that, they will flush the mitomycin through Foley's catheter. Then they will clamp the catheter. Then for 2 hours or 1 hour, like they will clamp. After that, they will release the clamp. Then the effect of drug will be absorbed through the bladder. That's how they will do. Okay, if the patient is on not on catheter, what we have to say? You can say the patient stop urination for 1 to 2 hours to retain the drug in the bladder. So option of B is the right answer. So next question. Here the patient present with the fresh blood in a fresh blood per rectum during the defecation. On examination, anal fissure is noted. So what is the type of bleeding is called as? Okay, what is the like from lower GI tract? If fresh blood is coming means what we call that one as? We call that one as hematochezia. What is melena? If there is a if there is occult blood, if there is occult blood or there is a upper GI blood, if there is a upper GI bleeding, it means that until the blood will come upper GI to lower GI, so that blood will be changed to black tarry color. Okay, black tarry color. Black tarry color is there means we call that one as melena. So here there is a fresh bleed is there. That's why we call as that one as hematochezia. And the next question from psychiatry. Here we are having the patient. Okay, a patient psychiatric patient is there. Discharged with the phenylzine. Okay, phenylzine is the MAO inhibitors. Okay, MAO nothing but methyl O transferase inhibitor. Okay, methyl O transferase inhibitor. That mention is on. So nursing officer instruct him about the dietary modification. Okay, when the patient is on phenylazine, we have to instruct the patient something. Okay, what is the most appropriate intervention for the patient who is on MAO inhibitors? So always we should say the patient will you have to avoid the tyramine rich food like your cheese and your dairy products should be avoided. Why you should avoid? Because it contain all your cheese will contain tyramine. Okay, tyramine will cause what will cause? It will cause the increased blood pressure. Okay, it cause increased blood pressure. We call that one as cheese reaction. Okay, we call that one as cheese reaction. So always tell the patient while discharging the patient, but always tell avoid cheese, avoid the dairy products. Okay, that are contain tyramines, you should always avoid during the MAO inhibitors taking tablets. So option number A is the right answer. So next question if you see means here we are having the like which of the following is not included in like Cinder's first rank of symptoms in a schizophrenia. Okay, this one to like differentiate between the schizophrenia and other psychiatric disorders. Other psychiatric disorders. Here, if you see, visual hallucinations are not a first rank symptoms of Cinder's. Okay, Cinder's. If you see Provincia class, okay, in Provincia class they explain clearly about the Cinder's first rank symptoms. Okay, first rank symptoms. It's all on the auditory hallucination, like voice discussing, like without any like hearing the patient. Auditory hallucination are the commonly seen in case of Cinder's first rank symptoms. Okay, visual hallucinations are never seen in case of never the part of first rank symptoms of Cinder's. Next one, which of the following is not a negative symptom of schizophrenia? Negative means something absent. Okay, something absent from the from the usual behavior. Okay, from the usual behavior. Okay, negative symptom. Negative means something absent from the usual behavior or called as negative symptom. Okay, all your evolution, allogia, anhedonia, all of these are the negative symptoms. Okay, except the ambivalence. Okay, what do you mean by ambivalence? Ambivalence is nothing but conflict. Okay, conflict in a decision taking. Okay, decision taking. Always the patient will be having conflict. Okay, two conflict will be there. Okay, one plus one negative. Okay, both conflict whether I will do or whether I will not do. Both conflict will be there in a decision taking. That's what your ambivalence. Okay, option number C is the not a negative symptom. It is an added to behavior. Okay, it's a positive symptom. So about negative symptoms, okay, anhedonia, allogia, evolution, all these are dealt by Praveen sir in a psychiatric series. Next one, okay, which of the best to describe about the conduct disorder in a children's. Here the examiner is asking you about the conduct disorders. Which one describes more about the like, conduct disorder in a patient? Okay, here if you see option of B is the right answer. Okay, here conduct means social norms. Okay, here social norms or rules, regulation, okay, that are all included in your conduct disorder. So repetitive persistent patterns of violating rules, norms, and right of others are called as conduct disorders in a children's. So option of B is the right answer. If you see conduct disorder, patterns of disorder, character, aggression, violation of rights of the others is called as conduct disorder. This has been discussed in a psychiatric class class by the Praveen sir. Next question. Here we hang the patient. Okay, prescribed with the disulfiram for the alcohol dependency. Okay, disulfiram means which acts as an aversion therapy. Okay, it act as an aversion therapy. Here the patient okay already prescribed with the disulfiram for alcohol dependency. So which of the following instructions should be nurse provide? Okay, if you see avoid, okay, aversion means avoid. We should avoid the alcohol while taking the disulfiram tablet. If the patient, okay, if the patient is already infected, not to take a alcohol when the patient taking a disulfiram, what will happen? There is a aversion reactions will be there. There will be a aldehyde reaction will be there. So always while giving the patient on a patient is on disulfiram, we should always instruct the patient to avoid the alcohol and alcohol containing products beverages. So this okay, disulfiram and alcohol like aldehyde reaction has been taken by Praveen sir in psychiatric series. And if we come to next question here having we are having next question. So here one more question related to the disulfiram as it came in NORCET mains. Here we are having patient with the alcohol disorders. Okay, alcohol use disorder initiated with the aversion therapy. Okay, which aims to discourage the alcohol consumption by causing unpleasant physical reaction when the alcohol is ingested. So which medication is commonly used for aversion therapy? Means here the examiner is asking you what is a drug? Okay, what is a drug used for aversion therapy? Here, like everyone knows answer clearly, disulfiram is a right answer. Here about like full about disulfiram, okay, and the reaction has been taken by the like Praveen sir in a psychiatric series, psychiatric all over like over NORCET mains, like NORCET 9 preparation series. Next question. Here we're having the patient excessively worried about having a serious illness. Okay, having a serious illness despite of medical reassurance and normal report. This condition is called as. Here, if you see means okay, a patient is having normal reports. Okay, the already doctor has been seen, done a MRI, CT, all scans are done, but every reports are saying normal. But still, the patient is worried about having some serious illness. It's also called as hypo hypochondriasis. Okay, hypochondriasis. This another name for hypochondriasis is illness, illness anxiety disorder. Okay, another name for hypochondriasis is illness anxiety disorder. So here, if the answer is there, okay, if in our option you're having illness anxiety disorder, that is your right answer. Okay, right answer. So option B is a right answer. Here, if you see like hypochondriasis, also called as here, if you see means like he also called as illness, okay, serious illness, okay, serious illness, also called as okay, illness anxiety disorder. Here the like in a psychiatric like video series, the professor is clearly explained about the hypochondriasis and its symptoms. Next question. Here the patient with the schizophrenia refuses to eat, saying it's being poisoned. Okay, what is the type of delusion? So patient is telling something. Okay, if you give him something to eat, it's saying I won't eat. He is clearly refusing the food. Why? Because he is telling that the food is being poisoned. So this is also called as delusion of persecution. Delusion of persecution means somebody is trying to kill me in the way of poisoning. Okay, adding the poison to my food. That are all ways. Okay, already someone is trying to kill me or trying to harm me. That is called as delusion of persecution. Delusion of persecution has been like taken by the like Praveen sir in a psychiatric video note. I can able to see that one and I can able to get the like correct your answer. Next question, 60th question. Here we are having the like patient diagnosed with the schizophrenia. Okay, tells the nurse there is a mention of me in today's newspaper. So which thought disorder does the statements mostly indicative? Okay, means the patient is telling my name is has been entered in a today's newspaper, but there is no name mentioned in the newspaper. He's telling my name is mentioned in the newspaper. It's also called a delusion of reference. Means the patient will say, okay, everything is related to me only. Something is happening outside, he will say that thing is happening because of me. Okay, he will refer everything, okay, every situation to him. That is called as delusion of reference. So if you see, okay, delusion of reference here, like Praveen sir has taken, okay, in class, okay, psychiatric class, he has taken, like he has clearly dealt about the delusion of reference. Next one, here we are having the 30-year-old unmarried man like, reports this intense sexual arousal when dressing in a woman's cloth, and he sometimes masturbate during these episodes. He denies to like desire to be a woman or a changing in sex. And what is the like what is this only like in private? What is the most likely the diagnosis? Here the person is okay. Here the man is there. He will wear the like other sex means woman's dress and he will masturbate himself. This sex is this disorder is also called as transvestism. Okay, here you can remember by the name called as transvest. West means wearing. Okay, wearing means you will get the sexual gratification by the wearing the dress of other gender people. Okay, that's what we call as transvestism is the right answer. Here about transvestism, opposite a dress. Okay, wear means wear. Here already like this class has been dealt by the Praveen sir in a psychiatric video note. Next question. Okay, long question, lengthy question, long term question is in front of you. Here we're having the 30-year-old unmarried when presents with the persistent hyperactivity and reduced need of sleep, markedly increased goal-directed behavior, including her work through a night for several days. And she like now she reports depressive episode approximately 3 months ago. Okay, I mean 3 months before she's having the depressive episode. Now she's having like exaggerated work. Okay, increased goal-directed behavior, hyperactivity is now presently. But 3 months before she was very depressive and but currently denies to a depressive symptoms. There is no psychotic features are present and her functioning is significantly impaired due to the elevated mood and activity. So what is the most likely the diagnosis? Here if you see means by seeing question you can able to so like identify it is a bipolar disorder. But you have to see before she is having depressive, now she is in current mania state. So option number A is the right answer. Bipolar disorder with the current mania episode. That's your right answer. Bipolar 1 and bipolar 2 disorder has been taken by the like Praveen sir in psychiatric class. 63 like which of the following is classified as like thought form disorder. Okay, form of thought disorder. Okay, there are like so many like disorders are present in psychiatry, like content of thought disorder, form of thought disorder, flow of thought disorder, disorder. Okay, here the exam is asking you which one is among the given option, which one is the thought form disorder. So here you see circumstantiality and dynasty are the not a thought form disorder. Here thought form disorder like has been taken by your Praveen sir, okay, in a psychiatric video classes from the NORCET-9 NORCET preparation series. Here we are having the like 38-year-old woman having woman with a schizophrenia on haloperidol. Okay, haloperidol is a like antipsychotic drug. Okay, it is an antipsychotic drug. Antipsychotic drug what will do, they will prevent the dopamine. Okay, they will prevent the dopamine receptor or they will reduce the dopamine levels. Okay, they will reduce the dopamine levels. So if you reduce the dopamine level, what will happen, there will be a Parkinson disease like symptoms or neuroleptic malignant syndrome will be there. So neuroleptic malignant syndrome will be there. So neuroleptic malignant syndrome, one of the feature will be akathisia. Here the examiner is asking you if you see the question, 38-year-old man with the schizophrenia on haloperidol reports the restlessness, trouble in sleeping, and he'll say, I can't stay like still at the night. Okay, what is the side effect of likely experiencing? So here the examiner is asking you what are the symptoms will presently seen in case of okay. Akathisia is the right answer. In akathisia, patient will feel trouble in sleeping, restlessness, and he will not place in sit in a one place. So here if you see like akathisia is most common extrapyramidal symptoms. Okay, that is what you are like rockling here. You see like patient will alternately sitting in a one place, will not sit in a one place. Here like this question has been came from your research. Okay, we consider this one research as a very least subject, but you should always focus on your minor subject also to increase your selection and to increase your performance. Here we are researchers want to ensure the like every group in a population has an equal chance being selected. So which sampling technique can be most appropriate to get the each one every equal chance. So here simple random sampling we can use for getting the equal chance for everyone. So option number D is the right answer. Here one more like a research question. Here researchers collect the historical. Okay, historical means old data on a group of subject and which of the following them determines the occurrence of the disease outcome, which is the type of which type of study design is thus described. Means here the researcher wants to collect the historical, okay, old data. So which kind of like design you want to choose for is studying the historical data. Always okay, retro means behind. Okay, retro means back. Always okay, retrospective cohort study, we can able to choose the right answer. Cohort or retro means always ulta, okay, always reverse studies. Here, okay, here also research question. Okay, in research, blinding. Okay, blinding means okay, like examiner binding or sampling binding. Okay, two bindings will be there, double binding or single blinding. So, okay, in research, blinding oftenly used, okay, during the data collection for target population to prevent what? Okay, to prevent the observer and data bias. Okay, observer and data bias prevention only going to use a technique called as blinding. So, option number A is the right answer. Here, if you see, okay, like it's pharmacology question. Okay, what is the recommended dose of zinc supplementation for the children's aged of 6 months and up to 5 years of diarrhea during diarrhea? So, 16 to 20 mg is the right answer. So, 16 is not there. Okay, here you can sorry 20 mg for 14 days. We can able to choose the right answer in case of diarrhea. So next question, long term question is there. Okay, if we see like I read out the question. A community health nurse, okay, is conducting the hemoglobin screening camp under the Anemia Mukt Bharat program. So she identifies several women and children are varying a degree of anemias. So nurse educate them. Like program is targeting the hemoglobin level and their like goal to reducing the anemia prevalence. So according to Anemia Mukh Bharat, what is the target hemoglobin level indicates the adequate correction of anemia. So 11 mg deciliter, okay, 11 gram deciliter is considered as normal, okay, target to, this is the goal of anemia, okay, to reach the HB of all women, okay, all women of reproductive age to be at the 11 gram deciliters. That is your target mg deciliter of like HB levels. So Anime Bharat, okay, like in Renaissance has been prepared like beautiful notes like regarding their community. From that notes only, so many questions has been directly like came to their NORCET mains examination. Okay, regarding Anemia Mukh Bharat, like Renaissance has made a note. Okay, you can able to see the notes. You can able to refer for your NORCET 10 examinations also. Next one, okay, 17th question. Acetic acid method VIA, okay, visual inspection method, okay, visual inspection method by using acetic acid, okay, which is commonly used in rural areas to screening of which following cancer. Here the examiner is asking you visual inspection by acetic acid method, okay, which is done for rural areas to screen which cancer. So option number C, cervical cancer, they want to perform VIA, okay, visual inspection by acetic acid method. They want to perform to diagnose, okay, not to diagnose, to screen the cervical cancer in a community setting where there is CT/MRI is not available. So next question, 71 question. Here the public health nurse conducting the community health assessment to determine the burden of chronic disease such as diabetes, hypertension in areas, okay, in her area. So she want to measure the reflect of both existing ongoing case and the case present in a okay ongoing so both okay existing case and ongoing case. Existing ongoing means incidence, okay, new case. Existing means old case. So if you merge, okay, old plus new case, we get the prevalence. Okay, we'll get the prevalence. So here on existing and ongoing case, she want to assess. Okay, measure the like existing both ongoing case and new case in a population. So which one is the following indicator most appropriate measure to burden the chronic disease in a community. So prevalence we can able to by the use of prevalence rate we can able to check the measure the like burden of the diabetic and hypertension in a population, the target communities. So option number C, prevalence is the right answer. So next one, okay, which one is a very easy question from community. Like, which of the following vector cause the Kala Azar or Leishmaniasis? Okay, was sandfly going to cause the Leishmaniasis or Kala Azar disease? Next one, Poshan Abhiyan. Okay, the Poshan Abhiyan or National Nutrition Mission is a flagship program for the government of India. Which of the following, okay, ministries are implement the overseas of this program. Okay, Poshan Abhiyan is comes under the which ministry they are asking you. Okay, here if you see ICDS. Okay, what do you mean by ICDS? Integrated Child and Women Development Scheme. Okay, Child and Women Development Scheme is a full form of ICDS. Okay, ICDS comes under Ministry of Ministry of Women and Child Development Ministries. Okay, option by A is the right answer. So this like ICDS, okay, ICDS and Ministry has been explained by the like Dhananjay sir in his video in his like community notes. Next question, 75 question. Here we have a community health officer educating the mothers about the government nutrition program. She explains the integrated child development, okay, ICDS scheme that provide the nutrition support to children, okay, up to the what age, okay, up to the what age does ICDS provide the nutrition for the nutrition supplement for the children, okay. This mainly target, okay, your ICDC means nothing but integrated child and women development scheme, focus on preschool children, okay, focus on preschoolers. So preschool nothing but less than 6 years children. So option number C is the right answer. So under ICDS, okay, sir has been like clearly okay told in his like in his community notes. Here if you see means okay, his benefit are like sorry, beneficiaries are 0 to 6 year children and pregnant women and lactating women are the target population under the ICDS. So next question, okay, which of the following I am according to IMNC, the child when comes to the fever, like following should be like nurse should be assessed the first. So according to IMNCI thinking about integrated management of neonate and childhood illness. So under this IMNCI, which disease is not included? Okay, which disease? Sorry, which disease is included? Okay, which disease assess the first. So if we see, okay, under ICD, like IMNCI, dehydration is a part of IMNCI. Your measles, sorry, your malaria is not included in your IMNCI. So option C is the right answer. Under IMNCI, malaria is not included. So here if you see means, sorry, here under IMNCI, okay, your like sorry, your diarrhea is included. Sorry, this one is not right answer. Sorry for the inconvenience. So option number like dehydration also included, measles also included, malaria also included. But typhoid is not comes under the category of IMNCA. Okay, integrated management of neonatal and childhood illness. This typhoid is not included, not a part of IMNCI. If you see the answer class IMNCI, diarrhea is included, measles is included, malaria is included, but not the typhoid. So they can able to easily rule out the typhoid in the answer. So which of the following communicable disease cause the highest mortality in India? So if you see, TB is very prevalent, very like high rate of incidence of TB is still there. So TB is causing high case of mortality in India. TB is the right answer. Here, like next question, what is the full form of INAP? Here they're asking you what is the full form of INAP? INAP nothing but Indian newborn action plan. Okay, Indian newborn action plan. Option number D is the right answer. Next question. Here we are having the like factory like following drugs are present. Okay, which one among the following drug is a bactericidal drug? Okay, bactericidal tuberculosis drug. Sorry, like which of the following is a bactericidal drug in a tuberculosis treatment? Except means which one is not a bactericidal? Here the examiner is asking you which among the drug is not a bactericidal. If you see, butambutol is the bacteriostatic. Okay, it is an bacterio bacteriostatic means it won't okay it won't kill the bacteria, so it will prevent the okay it will stop the bacterial growth. Okay, it will stop the bacterial growth. It inhibit the growth and multiplication, not will not kill the bacteria. So ethametal is a right option. So next question, so 79th question, which of the following program has been launched by first in India? Okay, if you see very oldest program of India is family planning program. Okay, family planning program is the very oldest program of the India. Next one, after giving the BCG vaccine administration, how many weeks? Okay, how many weeks should be like vaccine site should be checked for take response. Take response nothing but healed response. Okay, healed response. Okay, if we see after giving the BCG vaccine, what will happen? There will be formation of papule. Okay, papule and elevation over that. There is a pus collection over there. That is all reaction will take place. So after 4 to 6 weeks, there will be proper healed healed scar will be formed. Okay, healed scar will be formed. So option number C is the right answer. Next question. Okay, here this question is related to rota vaccine. Rota vaccine given through which route? Okay, here they're asking you route and prevent the which disease. Here the examiner asking you rotavirus is given through which route and will prevent the what disease. We see rota vaccine given through Given through 5 drops, okay, 5 drops orally to prevent the gastroenteritis or diarrhea, okay, or rotavirus diarrhea. Next question, if you see like vaccines regarding the uh, regarding your this vaccine, rotavirus vaccines, the answer has been given in a like community class, community video classes. Sorry, community notes notes center. We can able to get the answer rightly. So next question will be like 82 question under digital health mission DHM. What should be covered? Okay, if you see health ID creation for each individual should be covered in a digital health mission under the government of India programs. So option number C is the right answer. Here, if you see, like Dhanesar has been given a like short video note, short like notes on community programs and community concepts. You see that if you gone through the community notes, you can able to clearly answer like under National Digital Health Mission, like, health ID creation. Okay, health ID creation for eight individuals is the right answer. So this finishes your like all. I tried to cover almost all questions which are came in your NORCET mains. If you please check your right answer and you analyze where you are having lagging, where you are mistaking, where you taken mistaken, and you can able to analyze and you should not repeat the same mistake in your next upcoming NORCET 10. So don't lose hope if you're not getting selected. Also, your NORCET 10 is there, so many opportunities are waiting. First try to like cover the all subject, all concept, all like your syllabus under which comes under the category of NOSET. So you should always prepare, don't like neglect research, community and obviously, okay, always try to do maximum, then only you can able to get selected in your upcoming nursing examinations. Okay, thank you Anurag for watching it.